Where, in your view, do we have to go with the opioid issue? Where does the Surgeon General, the pivotal, critical point, you see moving ahead?
Well, again, my number one job is to educate the public regarding the science of health. And there are three areas that I'm focused on. Number one is naloxone, increasing the availability of naloxone. People have been misusing substances since the beginning of time. So why is it now an epidemic? It's an epidemic because people are dying like never before. And as a physician, when people are dying, when you come across a trauma scene, you've got to put on a tourniquet. Naloxone is that tourniquet. We've got to help folks understand. You just put out a paper where 52% of people don't think naloxone should be available without a prescription. 52% of people wouldn't say that you shouldn't know how to do first aid at a scene when you come upon an accident. I've got to help folks understand that naloxone saves lives and that it's a critical first step to connecting people to care. Number two, focused on educating the public about the severity of the epidemic and steps that they can take to respond, both from a prevention point of view, and I'm a father of 3 young kids. I'm interested in how do you prevent addiction in the first place, but I'm also the brother of someone who suffers from addiction. How do you help people find appropriate treatment if they do know someone who's suffering from the epidemic? And then number 3, focused on prescribing and prevention. As a physician, I feel like I have a unique ability to be able to speak to folks, to my fellow colleagues, and help them understand the role that they can play in helping us dig out from under this epidemic by following the CDC guidelines, but by prescribing responsibly, by becoming trained in how to treat substance use disorder and getting data waived so that they can prescribe buprenorphine and methadone and naltrexone and the substances that we know from an evidence base help folks recover from opioid use disorder.